talk to me a little bit about what it is that you see from your perspective in terms of ovarian cancer.
Well, unfortunately, ovarian cancer is scary. And the problem is there are not any specific signs or symptoms. They're very vague. Gas pain, distension, some pain, things that we actually have, often, but they just don't go away. And so a lot of times patients will go to multiple doctors with complaints over months and not be diagnosed. And then by the time they get to me, they already have advanced stage ovarian cancer, 70% of the time. And so these women have to go through extensive treatment, major surgery, either right at the beginning of their treatment or in the middle of receiving chemotherapy, and about 5 months of chemotherapy. That's extensive. So that's a lot for any one person to do.
For sure. So very to that point of what you were saying on how it comes about, and it's almost like a silent diagnosis, if you will.
Yeah, it's actually considered one of the silent killers, pancreatic cancer and ovarian cancer. So because it's advanced when we diagnose it, because there are no major symptoms.
That said, what is your suggestion from your perspective and what you've seen? And because it is one of those silent killers that you don't even realize until, unfortunately, in many women's case, it's too late. What is the suggestion there? How do you go about knowing the difference?
Yeah, it's hard because we don't have a great screening method for ovarian cancer, because what we have is not specific to ovarian cancer. And even if we use ultrasounds and tumor markers, we still tend to diagnose late stage. So what I tell people is you have to be an advocate for yourself as a patient. If you're having symptoms that you're worried about, you keep harassing that doctor or doctors to get workup, just like Lisa said. No. Another 90 days is not going to work. I'm having this pain. There is something wrong. We know our bodies ourselves better than anybody else. So it's very, very important just to be an advocate and be on top of it. And hopefully with research, especially with money that we could give from the foundation to researchers to try to figure out a better screening method or better test to try to diagnose this earlier stage. That's what we need to do.
Sure, and that's exactly what it is all about. And good for you, Linda, Lisa, for standing up and saying, hey, this is not right. And oftentimes we're not only do we know our bodies better than anyone else, we're also pretty good at ignoring our bodies better than anyone else.
Yeah.
So if you do have something that's just constantly coming up, the best opportunity that you have is to go and continue persevering and finding that doctor that will listen and ease, at the very least, ease that inside voice that's saying, hey, this isn't right.